Hi, Samantha. Can you hear me? Samantha, can you hear me? Hi, Samantha. Can you hear me?
Shireen, did you guys get my cookies?
Hey, Ashley, I haven't received any cookies yet.
They might be over at the warehouse.
Oh, okay. What'd you send?
Chocolate chip, but I doubt that they are still there.
That's okay. Thank you.
Melissa, did you get the photo I sent you?
We're recording, so the records button is down by the hand, at the end, the bottom. Goes over to your right, keep going, right click, see the circle, record.
Okay, we're gonna record.
And we're on YouTube.
Yes. And record to the cloud. Okay. And then there's
Thanks, Joe.
Jill's on.
Well, good afternoon, everyone. It is March 16th, 2021 at 1 o'clock. I'd like to call the Nevada Tribal Emergency Coordinating Council to order. And first part of our agenda is to call to order and roll call. And this is the virtual meeting with the new rules that we've been following for the COVID, and all those rules are on the agenda. So I'll ask the secretary to call the roll.
Harriet Parker,
Present.
Marla Stanton, Justin Blossom, Marianne Perez,
Not Jill Perez, I'm Ross Rivera. I replaced Jill Perez for the Shoshone tribe.
Alfreda Jake, Jackie Conway, Jackie Conway, Wayne Masters,
And we can just let the record show, please.
Wayne
Close.
Masters,
Master, Kimber Tribe.
Don Pelt,
I'm here.
David Hunkup,
Here.
Tanya Reynolds, Sakaki Charlie, Tashina Jim, Lisa Christensen,
Jackie's having issues with her audio.
okay, so we can show for the record that Jackie is here. Jackie's here.
Anybody else there?
So we got David Huncutt.
Hi, this is Alfreda Jake. I'm here.
We're just waiting for one more.
David Hunkup was here. Did you copy that?
Yeah, I got, yeah.
Oh, okay.
Tashina, Jim?
Oh, where's this?
Justin Blossom?
She's on the phone.
Jill Ward?
No, that's,
Oh, that's Ross.
that's Ralph, okay.
So he-
I don't know if that's on your local environmental.
Tanya Reynolds?
Here.
Yeah. Because I Ross. So.
Okay. And then 1, 2, 3, 4, 5, 8, and then a quorum.
Okay. Okay, it looks like we have a quorum. Sorry for that. This new technology is always a kind of a pain to work through. So now we'll move to item number 2 on the agenda. This is public comment for discussion only. No action can be taken on a matter raised under the agenda item of this agenda until the matter itself is specifically included on the agenda as an item upon which action may be taken. Public comments may be limited to 3 minutes per person at discretion of the co-chairs, and comments will not be restricted based on viewpoint. We are broadcasting this on YouTube, so if there's anybody watching this on YouTube and wishes to call in, the conference number, the meeting ID number is there, and then you have to hit *6 in order to unmute yourself. So please make sure that if you'd like to do some public comment, and there is a little bit of a delay, about a 90-second delay between the Zoom meeting and the YouTube. So we will leave this open for 2 minutes just to make sure that anybody that wants a chance to say something has the opportunity to say something. So I'll go ahead and open it up for public comment now. Again, if you're calling in and you're on the YouTube line, you're watching us, you're about a 60 to 90-second delay. So we're going to keep this open for 2 minutes. Kind of an awkwardness for everyone on the
Where's it
committee,
at?
where we're all kind of staring at each other, seeing if there's anybody out there in YouTube land that wants to talk to us.
Hi, I would like to just introduce myself, if I may.
Absolutely. Go ahead, sir.
Good afternoon. My name is Robert Laurie. I'm Red Cross Volunteer Government Operations. Pleased to be here, and I will just, for purposes of introduction, just watch so I can become acquainted with your work. Thank you for allowing me to participate.
Absolutely. Welcome to the meeting, sir.
Thank you.
Any additional public comment?
Yeah, this is Ross Rivera. I just recently hired on with the Ely Shoshone tribe. I am not a voting member if that is necessary to have a quorum for this meeting. I know Jill was a voting member.
Ross,
Just
you
let everybody know.
haven't gotten the letter yet, Ross. I typed up the letter this morning for you.
Okay,
So you are a voting member for us.
okay, so you did receive a letter?
For this meeting, yes.
Okay, thank you.
I'm sorry.
Okay, we've left public comment open for 2 minutes. And hearing no additional public comment from anyone, we'll move on to item number 3. Item number 3 is approval of the minutes. This is discussion for possible action. We're going to discuss whether to approve the minutes from the December 4th, 2020 NTECC meeting. And the minutes were sent with the agenda, and they should be part of your packet. Does anybody have any changes or additions to the minutes from our December 4th meeting? Hearing no changes, I'll accept the motion for accepting the minutes.
Dwayne Masters, I'll accept those minutes.
Thank you, Dwayne. Do we have a second? I think someone just tried to talk and you actually put yourself on mute. Ending in 154. Do we have a second for this accepting the minutes?
Dave Hunkup, Reno Sparks. I'll accept those minutes for December, what is it? December the 4th meeting.
Thank you, David. Okay, I have a first from Dwayne, a second from David. All in favor, say aye.
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 Any opposed? Okay, motion carries. Okay, we'll move on to item number 4. This discussion of current legislative efforts impacting emergency management, discussion only. We'll talk about the legislative efforts impacting emergency management in the state of Nevada, including an overview of the current status of bill draft requests to BDR submitted by the Division of Emergency Management. This presentation may include the following status items for SB 14, AB 14, and then an unassigned BDR about the reorganization of emergency management. Everyone should be on the list, or once a week we get the updates from the legislator council bureau. We've been emailing out on the listserv. So hopefully everyone's been getting that list of the different bills that have some kind of tie to emergency management for us, and you're able to see those. The 3 I want to draw your attention to, we have SB 14, and this revises provisions related to certain emergency response plans and assessments. And this one's been passed out of committee and to the Senate as a whole for review. This one cleaned up some of the language we needed to help fix the response plans. In the past, emergency management used to have to mail out the response plan guide to every utility company that was required to submit plans. This allows us to store it on our website instead of mailing it out to them. And also discusses some changes on who is required at the request of the Southern Nevada Water District. They are now going to be included in submitting those plans. And those plans we're talking about aren't plans that we look at and read. Those are plans that are submitted securely on the internet to us. We store them securely. And then in the event of a disaster, we can release those plans to local governments. That way they can see the emergency plans for that utility company or hotel, casino, or those kinds of things. So that one's moving along. The next bill we have is AB 14. This one revises provisions related to emergency management with the title. Doesn't really tell you a whole lot. This one cleans up some of our language on some of the meetings. If you're familiar with the Nevada Resilience Advisory Committee, it was listed 2 years ago to meet once a month. And through discussion with the members, we moved that from once a month to once every 3 months at the call of the chair. So times like right now during peak grant season, we could still meet in January, February, March, but then we could wait till the next quarter to have the next meeting. It also addresses the State Disaster Identification Coordination Committee. The committee never actually met before COVID and has met 3 times this year through COVID, but the statute requires they meet quarterly. So we moved that to an annual meeting or a call to chair. And that committee is kind of a morbid committee. It talks a lot with the coroners and medical examiners about how we can do mass fatality plans. And that is probably one of the, I think there's 3 committees in the state that is not subject to open meeting law, and the State Disaster Identification Coordination Committee is one of them. And so we moved that to an annual meeting or call to chair. So that way we can clean up those issues that we weren't meeting because we didn't have a need to meet. And then the third big change was relating to actually this group. We standardized some language. The language for this group said that we meet once every 3 months. We changed it to once a quarter. Same concept of every 3 months. That way we're within a quarter, but made the language consistent with what is in the other NRSs regarding the frequency of meetings. The third bill, the unassigned BDR number, and I believe it does have a BDR number now, but I'm not sure what it is because they haven't released it yet, is Reorganization of Division of Emergency Management. Right now, Division of Emergency Management works for the Department of Public Safety. So my position reports directly to the Director of Public Safety, although I'm also have a cabinet seat on the governor's cabinet. This bill moves the Division of Emergency Management to the Office of the Military. So the chief position would report to the Adjutant General, who is the department director, and would also retain that cabinet position on the governor's cabinet. We didn't change anything to our organization. We just changed where the organization lives with this bill. So it just picks us up, and moves us over to the Office of Military. And we thought it really aligned us well after the COVID disaster and how much we've used the Guard to support emergency management operations. We're much more tied to emergency management to the Guard than we are tied to the Department of Public Safety in most of our actions. So those are the three big BDRs that DEM has out there. I'd love to hear if anybody has any concerns about those three bills, or if you have other bills that you've noticed that you have concern with that we should discuss as a group and their impact on emergency management. Okay, hearing nothing, move on to the next item then. Item number 5, this is the NTECC logo review. This is discussion only, and we're going to discuss development of an appropriate logo to represent NTECC. And Harriet, are you on the call? Could you maybe give us some history, because this predates me, and I think that we probably want to hear that history, so we make sure that we know what we're trying to accomplish with this.
Yes, sir. So right after NTECC was formed, I'm trying to look at the dates. It's kind of hard to see from my phone on my computer, but it looks like in February, approximately February of 2019, during one of our meetings, we discussed a logo for NTECC, and I guess at that time, I believe there was a discussion of putting the word out. There was, I believe, a flyer was going to be produced and sent around, and it was open. The logo submissions were open to anyone. I believe they were going to drop off some flyers or send some flyers to local schools. And by the next meeting, which I believe was in March of 2019, I think there were only about 2 submissions. Long story short, throughout 2019, it kind of fell off the agenda by the end of the year. But I knew that there was a few submissions, but they wanted to broaden it because they weren't getting as much information as they had wanted. So, and then after, of course, then COVID hit, and then it just fell from there, of course. But so I know that it's something that I've spoken with a few other people just in conversation. They said, hey, whatever happened with the logo? And I said, I don't know, but I will bring it back up. I think it is something that we should look to that could represent us, and I think it would be a great idea. So I'm looking forward to everyone's thoughts.
Awesome. I couldn't agree more with you. We need to have a logo for the group, because I think there used to be one back in the old days, and we need to do a new one. But anybody got a good artist either on the committee or knows of one that could design something for us? Because I still use Crayolas when I try to draw stuff.
So for the record, this is Harriet. I do know a few people that could help us with that. What I was hoping is that we would have participation. Maybe we could look at putting together a group that would make the decision of which logo to go with. And again, I don't know how far to put this out there, if we should go back to looking at the schools and anyone who is interested. I believe one person had mentioned they preferred that it was a native that designed the logo. So again, I'm definitely open to suggestions of what everyone thinks and how we should, how far we should open it, and B, should we select to make the decision of the winning logo, if you will.
On the winning logo, just because of the open meeting law, I would prefer it comes back to the entire group and we vote on it. So that way then if we make a subcommittee of this committee, then they got to meet underneath the open meeting law, and that's kind of becomes awkward. So I would ask to meet the legal requirements that we all vote on the thing. But what does the group think? Do we want to send this out? Do we want Crystal and Ryan to get the word out for us? Do you guys want to get the word out for us? What works best for everybody?
This is Dave Hunkup, Reno Sparks. I'd just like to make a comment. I got cut off there a little bit, so I had to reconnect. I do remember that meeting that Harriet was talking about, referring to. And yeah, we had discussed about doing a logo for NTECC, and pretty much everyone was in agreement with coming up with a logo. And we had requested the word get out, that people put together a drawing or artist rendering of what a logo might look like. And I believe we might have had a couple submissions. It's been so long ago, I can't recall what they were or who submitted them, but if somebody has copies of those, that would be good, helpful to see what we got. But yeah, I think we just need to get the word out again to everyone and come up with a logo for NTECC and get moving on it, because I think having a logo for it, just for the NTECC, is really a good idea, and it helps boost our morale, and kind of just shows everyone that we're an organization that's viable, and we're there. I don't know. That's all I wanted to say.
Awesome. Thank you, sir.
I just have a comment. What kind of, what are we looking for? Do you have any criteria that you would like to see on this logo, or to make it more of an easier search for what you're looking for?
That's a great question. Again, that's why I wanted to bring this discussion forward. What everyone else thinks. I mean, it's for us, and it should be, something that we all agree would represent us. So I'm looking forward to other suggestions.
Do we want to have Ryan and Crystal put this on their weekly update report, and then get the submit? Anybody has an idea to send back to them, and then we can look at them at the next meeting?
I think that'd be a good idea. Yeah, I think that's great. Get it out there that way too.
Okay.
This is Harriet. I agree. I think that's a great idea. I think it's something that hopefully we can look at making a decision, pretty soon. Hopefully, maybe by the end of the year, at least have, since we don't meet as often, maybe have made the decision and have everything in the works, and have it set by the end of the year. Maybe have some letterhead or business cards or something for those, that work in that office. I think that would be great.
Being new to this council, does this council have a mission statement?
So Dave Fullerson, for the record, I'm not sure it really does. NRS describes what we do and what we're responsible for, but I don't know if we've ever actually gone through the whole branding process of mission, vision, values, and this plan.
for the record, this is Harriet. I was just quickly going through my binder from 2019, and that is a great point. I don't believe we ever had, oh no, wait, I apologize. I'm looking at our bylaws, and under Roman numeral 2, it looks like that the title of that Roman numeral 2 under our bylaws says purpose and mission. But I don't know if there's a specific mission statement. So that's something else we can discuss.
Nope. I'm gonna let Crystal talk for a minute here, because she sent me a note that it'll be much better for her to explain than me to try to explain.
Okay, so Crystal Harjo for the record. If anyone wants any information regarding NTECC or the travel affairs for NDEM, it's all on the website. If you click on the link on the front page, it says NTECC/travel affairs. It'll pull up our mission statement, our purposes, our bylaws, any type of information that has to do with our travel info. So you guys can go ahead and look and review there, and we're going to try to keep it as updated as possible. But like was mentioned, COVID threw a huge wrench into our public affairs stuff. So you can go there for some research, and we can certainly push out that on the travel report as well.
Thank you, Crystal. It's Dave Hunko for the record. Yeah, it's been a while since I looked at the NDEM website under NTECC, but that's a good idea. I think we all need to go back there from time to time to sort of kind of refresh ourselves as to what's there under NTECC. And in fact, I'm going to take a look at it myself here in a bit, but thank you. Good idea.
Sorry, Crystal Harjo for the record again. And what Ryan and I can do as an attachment on our weekly report is we can send out the old iTurk logo so you guys can look at that. And I believe John Backendall has those submissions from the previous NTECC logo discussion a year or two ago. So I'll see if I can get those, and we'll push those out and go from there.
So let's see if we can make, I like what Harriet said by the end of the year to get a logo. We meet 4 times a year, so hopefully by the next meeting in 3 months, next quarter, we can at least maybe get some of the old logos, look at those. And so we'll keep this motion or this agenda item on the agenda, so we can keep it until we pick the logo we're looking for. And then if you're looking at the mission statement and we want to address that too, let me know, and we can talk about that at a future board meeting as well. Everybody comfortable with that staff direction?
This is Harriet for the record. I appreciate that. I agree. I think that's a great idea. Thank you.
Awesome. Thank you, ma'am. Okay, we'll move to item number 6. This is update from the Intertribal Council of Nevada, ITCN. They will provide an update on ITCN activities to include support of the COVID-19 response and any other matters related to the support of tribal emergency management and health clinics. Have anybody from ITCN on?
It was going to be Shelby, but I'll see her on there. And I'll confirm her right now.
We'll table this one for a little bit to see if we can get a hold of that speaker. And we'll move to item number 7, because I do see Stacy on there. So this will be update from the Nevada Indian Commission. Executive Director Stacy Montude will provide NTECC an update of NIC activities, include support of the COVID-19 response and leadership with the COVID-19 Tribal Task Force. Director Montude, welcome.
Thank you, sir. Good afternoon to you, to that good-looking crew there, and to all the members of NTECC. For the record, I'm Stacy Monteith. I'm the Executive Director of the Nevada Indian Commission and a citizen of the Walker River Paiute Nation. I believe that everyone participating in today's meeting got my official report on the Tribal Task Force meetings. I don't want to, I want to be as respectful of everybody's time as possible, but just a little background for anyone who's new. The Nevada Indian Commission, in conjunction with the Division of Emergency Management, has been responding to the COVID pandemic with a response of food. Everything associated with food distributions, food needs, evaluations. The Nevada Indian Commission volunteered to be the point. And again, you should all have access to data that discusses those distribution efforts. I do have one update in the official report that I was able to provide to this group. There was mention that the Nevada Indian Commission was working with a vendor out of Clark County, a company called Get Fresh. They are the recipients of the USDA grant that provides food boxes to underserved areas. They work hand in hand with the Northern Nevada the Food Bank of Northern Nevada. We recently learned that 800 food boxes would be available to be distributed to our tribal nations to try to counterbalance location. As you all probably know, most of the food distributions have been centered in the Reno-Sparks area. We have our 10 Shoshone nations in Northern Nevada, Eastern Nevada. And so working with not just Get Fresh, but with the Nevada gold mines, we are having 800 food boxes delivered to a warehouse owned and operated by the Nevada gold mines. And they are distributing those food boxes to the 10 Shoshone partners that they work with. The new information is that the Lovelock Paiute tribe, as well as Native Americans from the Winnemucca area, will be also joining in on this food distribution, and learned just earlier this week that actually it's now going to be pumped up to 1,000 boxes, and it's also going to extend through April. And Nevada Gold Mines is once again happy, willing to help. And I can tell you all, I got to go up a week ago Wednesday, and it is such a full service operation. We had one big rig come in from a tribal nation. I won't mention who, but they were having trouble actually backing their vehicle into the yard. And somebody from Nevada Gold Mines actually even steered their vehicle into the gold mines yard. They didn't even have to, the drivers didn't even have to get out of the truck. The staff from the Nevada Gold Mines not only received the food boxes, they repackaged them. They had them lined up based on arrival. They load them into the vehicles. Again, some of our folks didn't even have to get out of their cab of their vehicles. So it's going really, really well. Does anyone have any questions that I can answer?
Awesome. Thank you, Director. Any questions for her? Awesome. Thank you very much for the nice partnership that we've all had together between ITCN, NIC, and DEM, and of course, Public Behavioral Health, but I don't want to give them too much credit.
Well, thank you, sir. I want to echo those sentiments. We're proud to be a part of such a well-operated a well-oiled machine, and look forward to continuing whatever we can do, not only with food distribution, but anything to, relieve the stress and the needs during this global pandemic. Thank you so much. I appreciate being included on the agenda.
Thank you. Okay, we'll move on to item number 8 now. This is update on tribal health preparedness efforts. Discussion only with Melinda Southard, Dr. Southard. NTECC will be providing an update on the Division of Public Behavioral Health tribal health preparedness efforts, include updates on the COVID-19 response report. Dr. Southard.
Thank you, Dave. For the record, Melinda Southard. I'm the manager of the Public Health Preparedness Program with the Division of Public and Behavioral Health. And I just really quickly wanted to share some super quick updates with you all. It's been a little while since I've been to one of these meetings. So we've been involved in the Binax Now testing collaboration and distribution throughout the state. So if there are any tribes that need Binax Now testing, please get in contact with Crystal, who can connect you with myself or with me directly, and we can get those tests out. The only drawback to the Binax Now tests for COVID is that they require that CLIA waiver certification, so there is a little bit of a process involved in getting that. But all in all, it's a very good test for COVID, and we do have those resources readily available. Additionally, we're very happy to have our partnership with Division of Emergency Management, and there are public health preparedness program staff in the ESF 8 desk within the State Emergency Operations Center on a daily basis with DEM, and we just really enjoy that collaboration with you all and getting the resources that our state needs for COVID-19. And just a quick shout out to Ryan and Crystal. I know you guys work extremely hard in collaborating with Nevada tribes, and I'm really thankful for your partnership as well. And then one quick last thing. So we have completed our application to the Centers for Disease Control and Prevention, the CDC, for the public health preparedness or public health emergency preparedness grant. So that was due today, and we got it in just right on the deadline there. So the application is in, and we should be receiving that funding here come shortly after July 1st. So continuing that program with NTECC and all that. So I think that's it for my updates, and just stand by if you have any questions.
Thank you, Melinda. I do got one little update, but of course he walked out of the room. We did steal one of Melinda's former employees, Rodney Wright, probably her best employee, and he now works with Division of Emergency Management as our state exercise officer. So sorry for doing that to you, Melinda, but thanks for the gain that we got on our side.
Yes, he is definitely missed, and I'm so happy that he went to you guys. So as described in our custody agreement, we can still call upon him at any moment, so we're okay.
And John, do you want to talk about the mobile vaccination unit? Just a real brief.
Sure. So this is John Backendall from DEM. I'm the preparedness manager here. We put in a resource order request with FEMA on Friday. We made the request for 2 mobile vaccination units, MVU is what I'll refer to them as. We were immediately notified not too long after that there's only 2 coming to the region, mainland region of California, Arizona, and Nevada. So we're looking like we're going to get 1, and California will probably get the other. And what we will plan on doing is starting it in southern rural Nevada, the Pahrump area, and making our way up through northern Nevada, across up 95, across 6, up 93, and then coming across both 80 and 50, and making its way through most of rural Nevada, both county jurisdiction as well as tribal jurisdiction. Crystal's been working with Indian Health Services to help coordinate additional vaccine as well as partnership with IHS to make this a collaborative effort to get as many tribal nations with vaccine in arms along those routes, as well as the hard to get to frontier areas of Nevada. So we just received a questionnaire back of things that I have to reply back to FEMA on today. So we're hoping to have an answer here real quick. By real quick, I mean a couple days. So give us some state and federal time there. And then hopefully not too long after that, 1 to 2 weeks, have it on the ground and be utilizing it. It does utilize the jurisdiction's vaccine. It does not come with vaccine. It also does not come with vaccinators or the logistics staff or vaccine efforts. We are partnering that with health to make the people available to facilitate the need, to where if we show up to a jurisdiction, you're basically going to get a break and we will supply the operation for you. You're in charge, it's your operation, you're the incident commander, we work for you. And we will facilitate the vaccine effort for you to put as many shots in arms while we're there, and then pack up and move to the next location. It's 2 very large trucks. One comes with all the backup generators and batteries to make sure everything works with or without available power. The second one is the unit itself. It's like a very large camper with 2 pop-outs and tents down the sides to do the pre-registration, to do the vaccine, as well as the post-administration monitoring of the patients. So everything is basically going to be intact, except for you having vaccine available in your location. So we're looking at, hopefully by 2 weeks from now, this is running through Nevada and hitting as many sites as possible. The 2 vehicles do come with 4 people. They're called a logistics support team, and they set up, break down, and travel the package from community to community. So we will be required to secure it at each location and then get vaccines in others. That's about it.
Perfect. Thank you, sir. Anybody have anything else on the COVID-19 response that we want to share that we need to make sure everybody's aware of? Only reminder I have for everybody is we have 2 warehouses full of PPE. If you need something, call, please call. I'm trying to not have a warehousing company for the rest of my life. So call Ryan, call Crystal, get those resource requests in, so that way we get you what you need. Okay, we'll move to item number 9. This is Nevada Public Bodies Update, discussion only. Tribal representatives appointed to the following Nevada public bodies may provide an update on their role with each public body, as well as initiatives and projects that impact Nevada's tribes. And we'll start with you, Dave, on the Nevada Resilience Advisory Committee.
Let me unmute myself. There we go. Good afternoon, everyone. My name is David Hunkup, Reno Sparks Indian Colony. I sit on the Nevada Resilience Advisory Committee, or we call it NRAC. I'm one of 2 tribal representatives. There's myself, and I believe Cassandra Darrow is still a member of that committee. The last meeting we had for the advisory committee was February 24th, 2001, and it was a Zoom meeting. And I'm just going to go through some of the highlights here real brief without getting into a lot of detail. Let's see here. There was a discussion of current legislative efforts impacting emergency management. Basically, it was the same legislative information that Dave Fogerson went over, the Senate bills and the BDR and those kind of things relate to emergency management. So it's basically the same thing he covered. There was some discussion on the proposed realignment of the IPAWS system, which is called the Integrated Public Alert and Warning System, collaborative group, or COGS. It was really just a discussion. There was a presentation to the group on the IPAWS. There was an annual review of the Nevada Resilience Advisory Committee bylaws. We talked a little bit about discussion, some of the items that I think there was some action that was taken. I can't recall what it was, but we did take some action on the bylaws, made some changes. There was a discussion on floodplain management and drought resiliency program update. There was just a discussion. It's a presentation given to the group on that subject. We talked a little bit about the Homeland Security Grant Program. There was an update on that from Kelly Anderson. And there was also a financial update that followed along with that. That was discussion as well with Kelly to the group. There was a kind of an interesting presentation about a preliminary disaster assessment tool, or what they called a PDA. There was a presentation by a company called Blue Raster, who's developing a PDA tool for DEM, and it's a pretty interesting tool that they're developing. And basically, what it does is it allows jurisdictions who are affected by disaster to use this tool to assess their disasters, and it's got all the information in there. You just put in the information, and you can link it. I guess it goes back to DEM and provides information on the type of disaster you got, the severity, and then also there's some costs, preliminary cost estimates that would go back that's helpful. So it looked like a pretty good tool. I don't believe that's been rolled out yet, but it's coming down. It's coming out here pretty soon. There was a discussion again, as always, on the EMPG grants. There was a review on the EMPG. Let's see here. What do we got here? Yeah, it was just really a discussion talking about the work plan and grant activities, those kind of things. So I'm not going to go into a whole lot of detail on that, but that was the meeting for February 24th. The next NRAC meeting is March 23rd, which will be next week. And so that's pretty much my update. Anyone have any questions?
Awesome. Thank you,
Thank
sir.
you. Thank you.
Okay, we'll do the Nevada Commission on Homeland Security, and Lisa's not here, but I believe we had a meeting in the Nevada Homeland Security Commission between this last meeting of this committee and today. And it was a very benign meeting where we looked at their strategic priorities to be maintained, and we continue to. Oh, sorry, Lisa Christensen, you're online. I'm sorry. Lisa, are you there?
Look like she's muted, but I'm not sure if she's on the call or not. Showing her name. Lisa, are you there? No response. I don't know.
So I'll just continue the report, and if she unmutes, she can add on to it. The last committee meeting, commission meeting, was kind of benign. We just reviewed the strategic capabilities maintained and looked at some grant performances that have been going on. Very short meeting, is probably 20 minutes or less. We do have another one scheduled coming up. So that way, as we start getting into the Homeland Security grant process. That kind of takes me to see Charlie here on the Finance Committee. We met the Finance Committee for Homeland Security the week before, to review the Homeland Security grant timeline. The Homeland Security grants were pushed out yesterday via the listserv for not only Homeland Security Commission listserv, but also the DEM listserv. So hopefully everyone's got those. And then Nevada State Emergency Response Commission. Lance, are you on? I don't see Lance. John, can you give us a little update from CERC?
So this is John Backendall from DEM again. I'm one of the CERC commissioners as well. So we were planning out getting more people active into the committees. So there's been several turnover positions with CERC. So there's a big effort by the chair and co-chair to get the committees filled and actually get those committees meeting now that COVID has kind of, I don't want to say dwindled down, but we're hit a lull where we can get back to some blue sky work. So there's already been 3 of the meetings scheduled this week to make sure that those committees are meeting in a timely fashion. They're talking about increasing the funding for their grant applications. So currently the limitations are $25,000 per grant for the United We Stand and the Opti grants. They're looking at making those upwards of 35,000 or more per grant. So for each jurisdiction, it will allow you to be able to have additional funds in a single grant and make it more available to you. The federal partners were also much more engaged at the last meeting. Homeland Security, DOT, a lot of the partners were on there giving their normal updates. But I think the most interesting part of the entire meeting was NDOT with USDOT support gave a brief on the new I-11 and what they've done through Nevada, as well as the closing the gap once they hit Northern Nevada and how it will intersect into Reno. They still have a series of options that are on the table, working with those local communities to see what will best work for those communities and what will best work for Nevada. Several of the rural jurisdictions have expressed concern in regards to the overpasses similar to Lovelock that was put in on 95 and 80, where there's the overpass over the community to where you don't go through the community. A lot of people like that, especially us drivers, but some of the small businesses in those communities are working with DOT and how to best make those overpasses and the entrances into the communities. So there's still some economic viability and you're not just bypassing every community in Nevada, but the traffic's still allowed to move forward. So we do have a presentation on that they made public. So if you guys would like that from this group, please let Karen know and we'll make sure that we get it shared out with the group. It's a PowerPoint presentation that really helps identify some of the final steps of the I-11 corridor project.
Awesome, thank you, sir. The Nevada Intrastate Mutual Aid Committee, we are meeting 29th of this month, so agenda should be going out shortly. We'll get it out, make sure we get a chance to see it. Yeah, I believe we got a couple of members of this group on that group as well. And we're gonna start trying to meet 4 times a year at that committee as well, to put some wheels underneath the bus for us to make the mutual aid system work better. You remember the NRS for mutual aid made all local governments part of the mutual aid plan, and then tribes can opt in. And I cannot do any justice if I don't encourage you to talk to your tribes about opting in if you've not already opted into the mutual aid. If you look at just the COVID response and how we've all come together, whether or not you participate in mutual aid, the fact that we're all signed on to the agreement together and we all show that we're in this together, I think is what really survived all of us through COVID. But I think having all of us signed on to that agreement saying that we're in this to win it together is a pretty important part. And then the Nevada Legislative Committee on Wildfire Mitigation. Clifford, I don't think you're on. I don't see you on. Does anybody have any questions from any of those updates? Okay, we'll move on to item number 10. This is update from the Federal Emergency Management Agency, Region 9. Chris, with our tribal liaison, will provide the NTECC with an update on FEMA Region 9 activities at a regional and Nevada specific level, and include updates on the COVID-19 response support.
Hey, good afternoon. This is Chris. Thanks a lot. Great to see some familiar faces and good to see you all. Needless to say, FEMA's been tasked with a lot of different missions right now, and we're very busy. At the same time, we're finding out that there are some areas where we can provide help, and also, like always, our partners are the ones that are really are the lifeblood of making FEMA go. We're the management agency. We're not the people that have all of the boots on the ground. So we've tasked quite a few different agencies in the federal family, as well as our great partners with the state, in order to get the work done. And of course, for the past year, we've been closely working with Health and Human Services and Indian Health Service, all of the, and CDC. Right now, from a national level, I just got off 2 national calls, so I'll give you what we have there. We had a call about funeral support to folks that have lost loved ones in the COVID response. The COVID disaster. And it's still, we're taking all of the information that we receive from tribal leadership to make sure that we craft our response to this as culturally sensitive and as correct as possible. So they're in the middle of doing that right now. We have set up right now about 2,500 person place where we're going to be taking calls. There's going to be a separate 800 number, but it's not set up yet, and we want to just make sure that it's done correctly. So that's what's going on right now. So I just heard that on one of our calls. The White House calls that have been going on every Wednesday are being changed to bi-weekly. So there will not be one tomorrow, but there will be one the following week. So that I think that's been really good. I was lucky enough to meet the White House tribal liaison, Mr. Rivera, virtually, and he's very interested in working with the tribal liaisons for FEMA across the country. So that was a nice thing that he took the time to talk to us. There's only about 14 of us across the country, so it's a small group, but we try to do the best we can with the assets we're given. There's also another thing. Senior leadership for Region 9 is down at the border right now, and they're meeting with tribal nations down there as well as state and federal agencies. Part of our tasks that we've been given by the new administration was to support the border. And we're down there right now with 2 teams, one in Arizona, one in California. That mission is just getting started. So I did hear from one of our people just before this call, and she reports that it seems to be going pretty smoothly at this point, but they're expecting it to ramp up quite a bit over the next few months. As far as we do have a vaccine task force that is set up in Washington, D.C. They're the ones that are going to be providing, excuse me, the mobile unit to Nevada if that works the way it will, and I certainly hope it will. And I'm certainly pushing it on my side. I think it's important that Nevada gets that, and California is also vying for one, as you can imagine. So there's only 2 given to the region in the 4 states that we take care of. We're gonna have to probably move it from state to state, but I think just so you know, you have an advocate working for Nevada to make sure that happens. The other part that's happening is Homeland Security is working on a virtual meeting in August with all the Homeland Security different groups. As far as the one group I've been advocating for quite a bit is for CISA to come and talk about what the tribal nations need as far as communications and web access. And they're definitely going to have a really robust presentation on that. So that's planned for late August at this point. It's still being worked on. But on something local, more local and close to home, we are going to try to stand up our tribal partners meeting that was scheduled for last year in Reno. And I've been talking to hotels and trying to ramp that up. And we're looking at right now is probably the 2nd week of January of next year. That's our plan. And I'll be sure and get that as much information out as I can. I wasn't able to report on that before because we weren't sure whether it would go through, but it looks like we've secured the financing. So I'll be talking to several of you about that down the road, especially Reno Sparks, because we'd like to talk to you about, the participation And I know Danny, you and I talked and worked on this before, so it's back on the burner. So I'm looking forward to working with you on that. And then Ron Hall is been assigned to tribal in Nevada. He's only tasked to be working with tribal nations that are direct to FEMA for COVID. So he has a very narrow focus. Otherwise, I'm still your tribal liaison for Nevada. Unfortunately, I'm not able to spend as much time with you as I would like, because it's always to me, it's always a real honor to go out to Nevada and meet all of you. That's about all I have at this point, but I'm more than willing to take any calls. I mean, any questions. Sorry about that. I'm on calls all day, so that's why I said that.
Awesome. Thank you, sir. And please make sure that the acting regional administrator knows that rural Nevada, and especially our tribal populations, probably use that mobile vaccination interval more than the urban core centers of, say, California. Arizona, I could probably argue with you on, but I think Nevada has a bigger need than California does when you start looking at our tribal populations that are in rural communities. So please make sure Danny
I agree with you. I've spent many months up there in that area, which is just not only gorgeous but full of wonderful people. So I totally agree with you.
Awesome. Thank you, sir. Any questions for Christopher?
Dave, this is Ryan. I have a question, please. Chris, good to see you. Hopefully get to meet you in person one day. I do have a question in regards to the funeral support. I was also able to listen into that call. And do you know if there are any plans in the future for FEMA IA to work with local and state agencies to work out the requirements on the death certificates? There was a question from one of our tribes who has unfortunately suffered multiple suicides, and that is not necessarily something that's listed on death certificate. So it may be preemptive, but there's potential for a number of our tribal members to be reaching out to the vital records department in their jurisdictions or with the state, and that could create some backup and additional hardship for those individuals if a process isn't necessarily worked out beforehand to try and streamline that kind of action.
I'll be glad to take that back and to the people that are working on this. But at this point, I have not heard that there were plans to do that type of work. But I definitely have heard it from more than one source that is a very big issue. And even on the call that you were on, that gentleman from New York who was talking about his situation as a unique situation, and more than happy to take it to individual assistance and see so it's on their radar too. So no problem, Ryan. I'll be happy to do that. If you could send me a quick email with the actual what you'd like me to cover, that'd be great, and then I can take that straight to them.
Will do. Thank you.
All right, sir. Yeah, look forward to meeting you too in person someday.
Outstanding. Any other additional questions for Chris? Okay, we'll move on to item number 11. This is interoperability update, discussion only. Melissa Friend will update NTECC on the current interoperability efforts in Nevada, include the status of the Nevada Shared Radio System, the First Responder Network Authority, also known as FirstNet, build out in the state, and an outline of the current status regarding the tribal communication. Melissa.
Good afternoon, Melissa Friend for the record. We'll quickly go over updates for the Nevada Shared Radio System. Right now, I'm speaking with the communications staff. Southern Nevada is in the process of being built out currently. and in the process of testing. They should be completely rolled out in 2022. The northwestern part of the state is in the design package phase with a build out of 2023. And the northeastern part of the state is in 2024. Everything right now is going according to schedule, barring environmental and all the issues that they're dealing with coming up with sites. From a FirstNet perspective, they've got 2 new sites going in Lyon County, 2 in Churchill, 1 in Elko, and 1 in Humboldt that should be up and running here shortly. And they're also planning they're calling it mega range, FirstNet mega range. So I'll read the first paragraph of the description so you guys all know. FirstNet mega range is designed to improve connectivity and throughput of data services on the cell towers. It's designed particularly for the edge of typical signal coverages, and it should vastly improve coverage in the remote areas, specifically tribal nations as well. The communications equipment box, we are working on the sat phone and subscription and the cellular internet subscription. I believe one of them is still in the process with public health to get the funding over to us. The sat phone subscription should have been purchased within the last week, so we should be able to get those out to you shortly. Barring any questions.
I did sign a grant change request for help this morning, so
that's the one that we're waiting on. So we should be good to go on this.
awesome. Does anyone have any questions on interoperability communications for Melissa? Okay, we'll move on to item number 12. This is project grant and financial report updates from BEM. Our NTECC representatives, Ryan and Crystal, will be providing us with updates on the BEM, Homeland Security, Tribal Support contract positions, the preparedness outreach, and then grant financial updates for NTECC. Crystal and Ryan?
Ryan, go ahead and go first.
Sure, thank you. Ryan Grichman for the record. So I am the new Cassandra or the new Jackie. I've been here for a little bit, so I don't know if I can quite claim the new guy status anymore. Most of you have been receiving emails from me for a bit, requesting information on the tribal weekly update. So I want to say thank you very much for providing those updates. I understand that you're not always able to provide an update each week. Sometimes things don't change. However, when you do provide that update, it's beneficial to all of us for information sharing. And I would like to just, again, stress the method in which to report, if you could, the can, condition, action, need. It is quite simple. I include an example in each of the weekly updates on how to do that. And it's just really simple. Condition could be same, action, continuing to vaccinate, need, we need some masks and gloves. We'll submit an RRF this week. So in regards to RRFs, we are working on a PPE push. We were able to purchase, NTECC was able to purchase some PPE through one of the health grants, and would ask that you submit those RRFs to myself so that I can keep track of it, and hopefully I'll be able to deliver it to you in person and actually get some face-to-face, hello, I'm Ryan, nice to meet you kind of thing. So myself and Mr. Ron Hood, the FEMA Tribal Liaison here in Nevada, will be reaching out to coordinate some meet and greets in the near future in conjunction, hopefully, with PPE delivery. Also, we're working, NTECC is working with ITCN to host a point of distribution for individuals in the Reno Sparks urban Indian population. And it's coming along, a whole lot of different hurdles to get through, main one being availability of vaccine, but please stay tuned for more information on that. And Nevada is progressively opening back up, and NTECC would like to invite you to take advantage of the many different training opportunities occurring and to request training exercises that you may have outlined in the exercise planning workshop we did a while ago, which was awesome. First one that NTECC has actually done. So that's a great step forward. And if you weren't able to attend that, or didn't list something that you would like to have, please, by all means, if there's a course or an exercise or a training or something that you would like to take place, reach out to myself or our training or exercise officers to help arrange that. And you can always go to the NDEM website and check out the awesome trainings that are available. Nevada is one of the few, if only in the state, United States, to have in-person training right now. We're following all the, I see the wave going. We're following all the protocols of COVID, and we haven't had any cases or spread or anything negative to occur outside of those as a result of those trainings. So with that, I'll move on to grants. I'll make it quick. A bunch of numbers, but they're important. So the Homeland Security Grant Program for tribal, the 2018, it does expire in August 31st of 2021. The total award for that was $85,632. The remaining balance is still quite significant, $75,901.71. The 2019 HSGP, Homeland Security Grant Program, expires August 31st, 2021. The total award for that was $92,700, and again, significant amount left of $90,682. 75, the Emergency Management Preparedness Grant for Tribal, the 2018 expired in December 31st, and we were able to use all of the funds for a total of $22,657.87. 2019 EMPG Tribal Award expires August 31st, 2021. That total award is $67,027, and the remaining balance of that is $58,560.10. And the 2020 was just awarded on March the 9th, 2021. More details coming on that. So as you've noticed, there's a lot of money out of the awards that are left, and I imagine you can surmise that the reason for that is COVID. Most of the actions and engagements that Crystal and I have been taking place in over the last year has came out of COVID monies for reimbursement. And so we do hope to, in the very near future, hope to get back on track with our more traditional roles and duties, and a large part of that on my end is the training and exercise. So I would invite you, highly encourage you to let's do some exercises, let's do some trainings, let's work together with your local jurisdictions, throw some things together, tabletops, full scales, whatever you want. It is what you would like, and we are here to support you in whatever needs and actions and concerns you may have. So with that, I'll end and pass it off to Crystal. Thank you for your time.
Before I go to Crystal, two quick things is one, remember we have PPE, we're trying to get rid of PPE. So if you need something, ask for it. I don't want to have a warehouse full of it for years. And second, Ryan, why do you have you knocked on some wood, because you said we haven't had a single COVID case in all the trainings. We all knock on wood here. Could you please knock on some wood for us for saying that aloud?
You hear me?
Crystal.
Great, thank you. Before I dive into some of the public health side of it, I do want to introduce Mr. Rodney Wright. Put a face to the name. We spoke about him earlier behind his back when he left the room, but he will be one of our go-to guys in terms of exercises for the state, and that includes the tribes. So working with him along with Lori, the training officer, will be coordinating a lot of the activities Ryan had mentioned in terms of training and exercise. So Rodney, they can't see you. So if you guys don't know him, here is Mr. Rodney.
Why don't you pull your mask down real quick so I can see. Hello, everyone. Rodney Wright here. I've worked with most of you when I was with Division of Public and Behavioral Health. So I look forward to working with you now over here on the emergency management side. And if you guys have any requests or needs, please reach out to me, and I'll be glad to help you guys out. Thank you.
Thank you, Rodney. So Dave and Ryan and John kind of stole my thunder. Just going to reiterate real fast. So Melinda had mentioned the allocation for the Vinex Now. Unfortunately, we heard this morning that if you are interested in getting the Vinex Now for April, we need the resource request by noon tomorrow instead of at the end of the month. So if your tribal clinic wants to receive some allocations for the April distribution, please get it to me by noon tomorrow morning, and I will send out an email to the tribal clinics specifying that. A little bit of a curveball, but we'll go forward with it. I know a lot of tribes previously got an ample amount of Vinex Now back in December, so it still may not be needed, especially with the extension of the Vinex Now. But if you guys are interested, just submit that to me and I'll push it forward. PPE. So Ryan had mentioned that NTECC had purchased PPE out of CDC funds. We spent a good chunk of that money getting PPE for the tribe. We also do have supplemental funding through EMPG. And so in order to rotate everything out that we currently have in the warehouse and to get the tribes the PPE that they may need, I sent out an email earlier this week explaining what it's for and when we need it by. So in order to kind of move it out of the warehouse and get it to you guys for distribution and use, please get those resource requests to Ryan by the end of day Friday. If you can. It's just we want to do a quick turnover. Again, like you said, he's doing the road show, and we want to make sure that if he needs to transport it to your tribe, that we have it scheduled and we can take it out to you. I am working with IHS in coordination again with EM and FEMA on the mobile vaccination units, and the goal is to get to some of the areas that I know a lot of the tribes have. For example, Fallon, Paiute-Shoshone's health clinic also serves Lovelock and Yamba, which has probably taxed their clinic personnel. So that is a resource that we could potentially send out to those communities and do vaccinations. And speaking with Captain Kramer over at IHS, he had mentioned that we could get additional vaccines. It doesn't matter which one it is. In the event that we get that mobile unit, so that the current allocations that the tribes are getting right now won't be the ones tapped into, we will have extras to go along with it. So the more people, the better. In terms of our regular day-to-day operations, trying to get back into resuming some of those, which also includes the activities, training, exercises, and as well as planning. So if you guys need any assistance in any of that, please reach out to our staff and let us know so we can coordinate with you guys in getting anything that you may need. We do have a lot of resources available through our partnerships for free or technical assistance in terms of planning, training, and exercises. Pending any questions, that's all I have for the group.
Awesome, thank you, Crystal. Any question for Ryan or Crystal? These two are phenomenal people we got working with us and the outreach they do and what they're keeping up with. And I just can't praise Crystal and Ryan enough. They are doing a tremendous amount of work for us behind the scenes that a lot of people aren't seeing. That it is unbelievable. So thank you guys. Okay, we'll move on to tribal updates, and tribal representatives will be given the opportunity to provide an update on any initiatives, projects, current events, or upcoming training opportunities related to emergency management within their tribal jurisdiction. They must be provided prior to the meeting for transparency to meet the open meeting law, and any update not provided, not submitted in advance of this meeting may not be heard by NTECC under this agenda item. So we do have one from the Las Vegas Paiute tribe that should be in your packets. Harry, would you like to talk about that?
Thank you, sir. I will be brief. just a couple things. Our current COVID numbers for March, and that's just March 1st through the 15th. My nurse advised me this morning that we have tested 10 patients. 4 of those were positive. 3 of them had previous positives. Those are our patients. Of our staff, we have tested 4, and of those 4, we have 1 positive. So as you can see, our testing numbers have gone way down. We're kind of looking into why. We don't know if it's due to our population, our community being vaccinated, or if they are receiving tests elsewhere. They're kind of looking into it, but our testing has dropped dramatically. So again, those numbers are just for the 2 weeks of March. Speaking of vaccine, our nurse, unfortunately, our nurse is working part-time for the next few weeks or so, and it was kind of hard for her to get some information to me. She just kind of scribbled down some numbers and couldn't really go into a lot of detail. So what I have is regarding our vaccines, since February, I believe it's the end of February, we have given approximately 400 Moderna vaccines. Approximately 250 of those were the first vaccine and 150 so far of the second vaccine. Those were included in those approximately 400 vaccines. That was all of our elders, interested tribal members, first responders, frontline workers, and I believe we are now working on any remaining employees. Of course, the community is in there as well, but also any remaining employees are now able to put in a request. We do not have a set vaccination day. They are creating it, I believe, 2 weeks in advance. They pick a date that the doctors are available, or a doctor is available, and working with our schedule, they are setting the date that they're at that time. So we don't have, that's all the information I have on our vaccine. Unfortunately, it's not very much information. Regarding our clinic update, a few of the things, we are still, all of our medical staff continues to work on a rotation basis. However, our administrative staff that was essentially working from home full-time basically, we are welcoming them back into the clinic. They are working 3 days a week in the office and 2 days are working from home, and they are also working on a rotation type basis. So those are administrative employees who do not see any patients or any clients. Our clinic hours are back to 8 a.m. to 5 p.m. We are in the process of switching to the Greenway electronic health record system. It doesn't pertain to me. I was not a part of that switch, but I believe we're in the final week of it. I know that the last 3 weeks, the switch to Greenway has also affected our patient appointments and also the vaccination, as our system was kind of down, and we had to essentially, the providers had to essentially handwrite everything for, I believe, 1 week. It was not fun for them anyway. But I believe, as I said, we are in our final week of it. So I believe next week everything should be up and running and smooth, knock on wood, and everything will be a go. We are also in the process of switching all the faucets in our clinic, which includes the exam rooms, the break room, the restrooms, all of them to the automatic no-touch faucets. Believe it or not, Every faucet in this clinic has the turn handle kind where you have to touch it to turn it on. So we're in the process of switching all those out. We were able to receive, I believe, 4 quotes on that, and they're making the final selection and hope to get those installed pretty quickly. We're also looking into making a zero pressure exam and treatment room for COVID patients. This would have a separate entrance, a separate air filtration system, et cetera. These are all just preliminary. Preliminary meaning this COVID room that we're looking at. I believe our director is reaching out to some contractors to see what's available. He's also working with our tribal chairman to find out the best way to put this into effect. There's been a lot of concern with having testing and vaccinations coming in and out of the same area as our regular patients. We are continuing to do telehealth where appropriate, but as everyone knows, sometimes you cannot do telehealth. So there was some concern and fear in our community. So that was one of the reasons that we looked into the separate COVID room is what we're calling it. And I'll keep everyone updated on that if that comes to fruition. The next item I have is a food distribution. The Las Vegas Paiute Tribe is working in coordination with the Las Vegas Indian Center. We are having our second food distribution. We had one last year. It was a success. And that was, we're partnering with the Culinary Academy of Las Vegas. They received a grant and they reached out to us to have that food distribution for our community. So that food distribution is scheduled for Friday, April 23rd from 9 a.m. to 11 a.m. Unless we run out of the food boxes. And I believe they have scheduled for us between 170 and 200 food boxes. And unless there are any questions, that is the end of my report.
Awesome. Thank you, Harriet. Any questions for Harriet? Looks like Dan, you raised your hand.
Harriet, this is Danny Thayer. Are you guys also looking at a negative flow for your dental area? I know we're taking a look at one here for Reno Sparks Tribal Health. Just kind of curious.
That is a great question. I don't believe that it has been brought up, but I will certainly ask. I know that we had plans in, I believe it was 2015 or 16, to work on a zero pressure, negative pressure room. I actually went down to, I was already in Phoenix for training at IHS, but I was able to look at several of their rooms there. But unfortunately, it didn't happen. So now we're looking at it again, but I don't believe that dental was brought up, but that's a great point. I will see if that's something that they're looking into.
Great point. Thanks, Danny. Any other questions or comments for Harriet? Okay, we'll move on to item number 14. This is public assistance grants. This is Kelly, or I think Samantha is on to give an overview of the status recovery efforts under the COVID-19 disaster recovery grant, which includes a summary of recovery projects, total amounts of disaster funding approved and pending for state of Nevada and other tribal entities. I want to make sure that everybody knows about the FEMA Public Assistance Grant Project and that we can provide 100% funding for any vaccine-related events in order to keep you going forward with all you need to do. I know IHS and Health from DPPH have a lot of funding as well. Just want to make sure that we had another opportunity to get out in front of you about the public assistance grants that FEMA does have. Samantha, are you on? Or Kelly? Okay, it doesn't look like either one's on. But as I was saying, we do have for the vaccine, it's all 100% reimbursable grant. So we'd love to be able to help you if you do have needs. Reach out to Ryan and Crystal, and they put you in contact the right people in our shop to get you the right conversation to have. I know that Health and IHS has got a lot of grant funding already out there. We just want to make sure that if there's something else out there that their grants don't cover, to see if we can help you with that covering. So please reach out to Ryan, Crystal, and they'll get you in touch with the right folks, and we can go forward with there. Any questions on public assistance? And Kelly just walked in the room, so we'll get a quick update from Kelly.
Hi, good afternoon. Kelly Anderson for the record. Sorry about that. I was on the YouTube channel and I couldn't talk to you through the YouTube channel. Technology. So right now we have approximately $140 million worth of recovery grants in the system and the state portal. And we're working, actually the federal portal, and then we're working to get those into the state portal. We don't have a whole lot of tribal project worksheets in the system right now. So one of the reasons why we wanted to give you an update is to ensure that you have this information and you know that our staff is able to assist. If you have any unreimbursable COVID expenses over $3,000, we'd like you to contact us through our office so we can assign staff to assist you with writing project worksheets. Right now we're at 100%. So it's really important for all of our communities to ensure that we use this funding to help our communities recover. So I can answer any questions that you may have on the process or any other questions that you may have on public assistance.
Awesome. Thank you, Kelly. Any questions for Kelly? Thank you. Okay, we'll move to item number 15 now. This is public comment discussion only. We just like the public comment we had at the start of the meeting, this is going to be delayed for the YouTube folks, like Kelly, who has to run up to the room here to talk. So we will keep it open for 2 minutes. So no action may be taken on a matter raised on the item of this agenda until a matter itself has been specifically included on the agenda as an item upon which action may be taken. Public comments may be limited to 3 minutes per person, discretion of the co-chairs. Comments not be restricted based upon viewpoint. Because there's no physical location of this meeting, public testimony under the agenda item may be presented by phone. To provide testimony during this period of public comment, please call in anytime after 12:30 p.m. the day of the meeting by dialing the number there. When prompted, hit the meeting ID number that's there and then press pound. When asked for public comment, please press *6 to unmute your phone and *6 again when your comments are complete. So we'll open up for public comment. If you are on YouTube and you're calling in that phone line, again, *6 to unmute, *6 to mute. Do we have any public comment? And just like at the start of the meeting, this is that awkward 2-minute pause where we all have to sit and look at each other to make sure that if anybody is on calling in, that we provide them an ample opportunity, because we want to ensure that anybody here can go ahead and provide public comment. So any public comment? One more minute, we'll leave public comment open for. If you're calling in on the phone number, it's *6 to unmute yourself. I do appreciate everyone coming together for the meeting today. I really appreciate it, especially a couple of last minute folks who got us to the quorum. So thank you for those of you who showed up last minute to get us to meet the quorum today. Okay, again, if you're calling in on the phone line, *6 to unmute yourself. And see no public comment, and it's been open for 1.5 to 2 minutes. So I'm going to go ahead and close public comment. We'll move to the next item on the agenda, which is adjournment. I'll accept a motion to adjourn from Member of the committee?
This is Don Pelt from Pyramid Lake. I make a motion to adjourn.
Thank you, Don. A first from Don. Do I have a second?
Dave Humcup, Reno Sparks. I'll second that.
Thank you, Dave. All in favor, say aye.
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 Anybody wants to continue to stay in the meeting for as long as you want, please say nay. Thank you all for the meeting today. Great discussion. Remember, reach out to Crystal and Ryan with any of your needs. Always feel free to call me, email me, text me, whatever you need. We're here to help. Thank you, guys.
Bye.
Bye.
Stop it.